This video is to demonstrate how to do a catheterization on a female patient. Before we begin, we want to make sure that we have all our equipment. We want to make sure we have the betadine wipes, the urinary catheter, a collection portion for where the urine's going to go so we can collect that. We want to make sure we have water lubricant to use for the catheter. We also want some soap towelettes. We want any blankets needed, any privacy measures needed, extra gloves as well as sterile gloves. And we want to make sure all our equipment's set up and ready to go. We also want to make sure that if we need extra help because our patient is of a larger size and maybe can't maneuver by themselves, or if they're confused, or if we need another set of hands, we want to make sure that that's available so we don't need to leave the procedure and start all over again with new equipment and so forth. We also want to make sure that we have orders. So the biggest thing is making sure that we have correct orders for our patient in order to do this procedure. We also want to make sure we have the right patient. So we want to do this by confirming at least twice, two different ways, with either a date of birth, a patient ID, anything like that, just to make sure that we have the actually correct patient, name, date of birth, etc. We also want to take the time to explain the procedure to the patient. Are we doing this because they aren't ambulatory and we need to do a urine sample? Or if they're sick, maybe in the ICU or something like that, where they can't get up to urinate themselves and collect it that way, we would need to do a straight cath. So maybe they're in the ICU for something and they're intubated, or they're not able to walk around and so forth. From there, we have everything positioned, ready to go. We're going to make sure we use hand hygiene, so wash our hands, hand sanitizer, etc., and on a new pair of gloves. So now that everything's sterile, we are good to go with that, and we can get started with our patient. So again, we're going to begin by confirming our orders and verbalizing. We want to make sure that the patient has no allergies, confirm name, date of birth, patient ID, etc. So once we confirm all of that, we are going to explain the procedure to the patient. We're going to make sure that we are on the correct side of the patient. So if you're right-handed, you want to be on the right side, or left-handed, if that's your dominant hand, you want to be on the left side, just to position yourself comfortably. You want to make sure that there's a trash receptacle or a biohazard, so you're not reaching over the patient and you're not leaving supplies that have been used on the patient's bed or on the clean work area or anything like that. So make sure everything's good to go. We're going to use sterile techniques to open the catheter insertion tray. And we're also going to use sterile techniques to don all of our gloves on and off, etc. So we are going to prepare the catheterization tray once we don our sterile gloves. So at this point we can, prior to doing that, we're going to position the patient. We want them to be in a dorsal recumbent. So in order to do that, we want to make sure their feet are flat on the bed. Patient's knees are bent, and then we're going to have them relax and rotate their thighs outwards. This gives us the best visualization of the urinary meatus, and that way if anything happens where we need more light or we need to position the patient differently before we get started, and once we have our sterile gloves on, we won't be able to do so. So we want to prepare all of this ahead of time. We also want to make sure that we're draping the blanket over the patient for privacy purposes, making sure that the curtains are drawn or however we need to make sure that this is a private procedure so the patient can be more comfortable. We also are going to, at that point, do some hand hygiene, switch out our gloves, and organize our sterile work area. So we're going to take our old gloves off, hand hygiene with sanitizer. At this point, we're going to put a new pair of sterile gloves on and organize everything. So we're going to make sure with our betadine wipes, these are the stick portion with the cotton swabs. We don't have forceps in this kit, so we're going to open this, but we're going to leave the swabs covered, and we're going to make sure that we open it where the sticks are on the top portion so that we can grab those easily. We're also going to use a sterile underpad, make sure that the shiny part is down. This will help keep things neat and clean for however we need to. We are going to put our sterile gloves on. Now remember, once these sterile gloves are on, you need to make sure you're following every sterile technique because once you do so, if you don't do it correctly, you'll end up contaminating things and you'll have to start all over with a new catheter kit. So from here, we have our lube, which is water soluble right here. So we're going to take that and we're going to put it in the tray. in order to lubricate the catheter as needed. So in order to lube the catheter, we're going to make sure that we're grabbing it with our sterile hands. We're going to lube the tip of it, and we're going to do the first 1 to 2 inches. We're going to lube that up, and we're going to leave that catheter in the lube so that it doesn't touch anything. Everything still stays sterile from that sterile catheter kit. We're going to make sure that we're laying everything out how we need to. And at this point, we have our catheter prepared. It's lubed. We have our cleansing wipes ready. We had already cleaned the perineal area prior to putting on our sterile gloves, just to make sure that that area was completely clean. Anytime you're wiping anything, you want to make sure you're wiping from front to back, so towards the buttocks. That way you can avoid any contamination or risk of infection at that point. So once we clean the perineal area, again, we do top to bottom, etc., we are going to start the process of cleaning the urinary meatus. So from here, we are cleaning, we're going to spread the labia with our non-dominant hand. So again, if you're right-handed, use your left. Make sure that you are spreading this with your thumbs and your forefinger. You're gonna pull up and out at the same time, and this will give you the best visualization for the urinary meatus. At this point, if labia does slip over the process after you've cleaned it, you need to re-clean it to make sure that there's no contamination at that point. So with your dominant hand, once we spread the labia how we need to, we are going to clean this. So we want to make sure that each betadine is just being used once, and we're going to start away from us. So from here, we're going to make sure that everything is spread with our non-dominant hand how we need to. And again, top to bottom. So we're going to do one wipe that way. Once that wipe's done, you're going to grab another one. You're going to still hold this the whole time. You're not going to let go of anything. You're going to do the one closest to you. And then lastly, we're going to go right down the middle for the urinary meatus, just one stroke down like that. So now that that's all cleaned, we're still holding the labia open so that we can see the urinary meatus, so we have good visualization. We got rid of all our betadine swipes at that point. We know that the urine receptacle is all set. We want to position that about 4 inches from the meatus. And at this point, with our dominant hand, we are going to grab the urinary catheter. We want to make sure that the rest stays coiled in our palm. We're going to hold the catheter right about 2 to 3 inches from the tip. We want to make sure that this is secured, and we're going to coach our patients with some slow, deep breathing. And as soon as we start inserting it, we're going to ask them to bear down as if they need to void. So again, this hasn't touched anything. And we're going to say, okay, here's the entrance. And you'll see that. We're going to continue to put this in. And once we start to see urine, at this point, we're going to continue another 1 to 2 inches. So we will continue on through there, not letting go of anything. Make sure that if you do touch the labia, or if you do the wrong placement, wrong hole, anything like that, you have to use a completely new catheterization kit. You can't reuse this. Sometimes it's helpful if you keep it in the wrong hole. That way you know the next time that you're going, you'll be in the urinary meatus at that point. So you're going to manage the catheter. You're going to hold the non-dominant until the urine stops. Collect that urine in the specimen. Once this urine stops and we've collected everything and the bladder is now empty, we are going to remove the urine-filled receptacle, set it aside, and we're also going to remove the catheter at this point. Again, make sure you're telling the patient to breathe as comfortably as they can. So we can remove that from there now that the urine stopped, and position that how we need to. So we can discard all of this. We have our urinary collection point at this point. We're going to cleanse and dry the perineal area again with our wipes, making sure that these stay clean. We're going to remove and discard any supplies. We're going to remove our gloves, wash our hands to follow proper techniques. We're going to return the patient to position of privacy now that they're clean and they're comfortable. So we're going to make sure they have privacy, position of comfort. Then we can collect the urine, discard everything, and clean up the area. And from there, we will send the urine off if it needs to be tested for anything, and record everything needed for the urine specimen. And that is how we catheterize.